Hi, everybody. Welcome to our first ever virtual Lunch and Learn hosted by Chaffee County Public Health. We are here today to talk about COVID-19 vaccinations, and we're so glad you've joined us. To start, we'll do just some introductions of your presenters. So like I said, my name is Emily, and I am a nurse with Chaffee County Public Health.
My name is Cassandra, and I am a nurse at Chaffee County Public Health as well.
My name is Tanya Waite. I'm also a nurse at Chaffee County Public Health.
And my name is Clara. I am an AmeriCorps Vista at Chaffee County Public Health.
Great, thank you. Well, to start, I just wanted to set some expectations for this presentation. First, we want you all to know it's very okay with us. If you're skeptical and on the fence, please ask questions and seek out reputable information. We don't know all the answers. This is a very overview presentation, and we will do our best to link to experts in the fields, but this is just an overview. We will take questions in the chat and we'll do our best to answer them at the end. However, we did get a lot of questions sent to us ahead of time, and we have answered all of them that we have gotten at the end in our Q&A part. So hold your questions. You might get them answered eventually. And then lastly, not that we really expect this to be an issue, but we do want to be clear because we know vaccines can be controversial, that while we're okay with questions and skepticism, we will not engage in any sort of trolling or antagonizing comments. So with that being said, let's move on. So the first thing I want to touch on is how this vaccine was made so quickly. This is one of probably many people's biggest concerns. And so I hope that in this very brief explanation, I'm able to ease some of those fears. Okay, so this last year, we have seen one of the biggest scientific achievements in modern history, and that is the development of multiple COVID-19 vaccines in less than a year's time. Vaccinations have always been considered one of public health's greatest achievements, but this year has really put vaccine science in the spotlight as the true ticket out of this pandemic. All right, so let's talk about how this happened so quickly. And I want to recognize that it's okay to be nervous at the speed at which these vaccines were developed, and I hope this is helpful. Okay, so both the Pfizer and the Moderna vaccines, which are the two vaccines that we currently give in Chaffee County, utilize mRNA technology, and this has never been used in a vaccine until now. However, mRNA technology has been studied for decades as a possible vaccine method or in other medical scenarios such as treating cancer. So while it is new for an approved vaccine, utilizing mRNA technology is not really new to many scientists. They just didn't have a disease that could be vaccinated against that would work until COVID happened. This part was really interesting to me. So in order to get approved for a vaccine to get approved, vaccine manufacturers have to present quite a large amount of data before they can even be considered. And that's really hard to do. So it's hard because it's not many people are lining up to get a vaccine that's in trial, and there's not typically a ton of disease circulating. And you have to have a lot of people, and they have to have lots of time to get exposed to the disease before we can prove it's safe and effective. Now, in a global pandemic that has interrupted our entire way of living, finding study participants was actually quite easy, and gathering data was even easier because we have a disease that is circulating widely that nobody is immune to. Another reason we were able to do this so quickly is because a lot of the bureaucratic red tape and the very slow step-by-step methods were expedited, not because anything was skipped, but kind of the junk that happens in between was taken out. So for example, the FDA came along with vaccine manufacturers through phase 1, 2, and 3 so they could see how it was done instead of phase 1, 2, and 3 happening, and then the FDA comes along. And then lastly, and one of the most important things is money. So the US government took away a lot of the financial risk by essentially bankrolling the production of 6 promising candidates in large quantities before clinical trials were over. So essentially, if the vaccines worked, then great. We were years ahead of where we would have been before. If the vaccines didn't work, then the government was just out that much money, but taking away that financial risk really helped things move much more quickly. Okay, so for you science nerds, let's talk about how this mRNA vaccine works, because it's very interesting. So mRNA, or messenger RNA, is like an instruction book. And so in the Pfizer and Moderna vaccines, the mRNA is what is in the vaccine. So it enters the cells of our body and tells our body to manufacture the spike protein that is unique to COVID. So if you look at the pictures of COVID that we have on our screen, those red spikes are the spike protein that our vaccines are targeting. So the mRNA enters the cytoplasm of the cell. It's coding for the spike protein. The spike protein is made, and the body then says, wait a second, this is something foreign. I don't want this in my body, and it mounts an immune response to it. So it is making antibodies and other immune cells that are very specific to the COVID-19 spike protein, so that in the future, if your body is exposed to the real COVID-19 virus, your body has an army of immune cells that are ready to go, specifically made to attack that spike protein. So the antibodies will latch onto that spike protein and mark those virus cells for destruction. The antibodies also block the spikes from attaching onto other cells. So the mRNA part of this vaccine is very new, but your body recognizing something foreign and mounting an immune response to it is how almost all other vaccines are made and how they work.
Okay, so I'm just going to talk about the 2 vaccines that we are currently using at Chaffee County Public Health, and they are from the Moderna and Pfizer companies. So they're very similar. As Emily has just discussed, these 2 vaccines currently available both utilize mRNA technology. The only real differences functionally are that they are given at different dosing times. So Pfizer only has a difference of 21 days between the 2 doses. Moderna is slightly longer. They're given in a series 28 days apart. The other difference would be that the dosing is slightly different. Pfizer is given in 0.3 mils and Moderna in 0.5. We do want to stress as well that whichever vaccine is available whenever you are eligible to receive it is the one that you should get. They are both very, very effective. And to the point that before the clinical trial data was released, we weren't even sure that this level of effectiveness would be possible. So it's really exciting to see that. Otherwise, Pfizer is available for those ages 16 and older, whereas Moderna is only available for those ages 18 and older. The other thing that you may have heard is that Pfizer is actually stored at a little bit of a colder temperature. By a little bit, I mean negative 80 degrees Celsius, so it's very cold. So that is a little bit of a logistical challenge, whereas Moderna can be stored in regular freezer temperatures for long-term storage. So both of these vaccines are a 2-dose series. So it's really important that when you are able to register for your dose of vaccine, if you're interested, that you do make sure you're available to get that second dose either 21 or 28 days later. Just due to the allocation and sort of the high demand that we are seeing right now, it is really important to make sure you're available for those second doses. The CDC does allow up to 42 days after the first dose to get that second dose. But just in terms of scheduling that, it is a lot easier if you are available for that second dose at that time frame. So just keeping that in mind. And then both doses are important just because while you do get some immunity from the first dose, you get a lot more if you complete the series. And then we did just want to mention the Johnson & Johnson vaccine really briefly as well. You may have heard recently that it was found to be safe and effective by the FDA just, I think, yesterday. So we are expecting to see an EUA pretty soon here. The vaccine is very similar to Moderna and Pfizer in that it does utilize a spike protein from the COVID-19 virus to have your body mount an immune response to it. So that's very similar in the way that your body will recognize it. However, the method is a little bit different. The J&J vaccine is a viral vector vaccine. So it utilizes an adenovirus, which has been deactivated, so it's not going to cause you any illness. The adenovirus vector, you can kind of think of it as like a letter with a message. So the message would be the information that your body needs to mount an immune response, and the adenovirus itself is more the letter that's carrying the message. One thing that is nice about the J&J vaccine is that it is a 1-dose series, so you only need a single shot and then you're good. And then it is also stored at refrigeration temperatures. All 3 vaccines have been found to be very effective at preventing symptomatic COVID disease and hospitalization. So if this is the one that you end up getting, this one is also a really great option.
All right, so who should and who should not get this vaccine? That's our next subject. So who shouldn't? Anybody who's had an immediate or severe allergic reaction to a previous dose of the COVID-19 vaccine. So an immediate allergic reaction is defined as any hypersensitivity related sign or symptom. This could be urticaria, which is hives, any swelling of your lips, tongue, or throat, any respiratory distress. This could be wheezing, stridor, having a problem catching your breath, or any anaphylaxis that could occur. Usually this will occur within 4 hours following administration. If this does occur, it's a good idea to let your physician know and talk that through. A severe allergic reaction is anaphylaxis. So if you have ever had a severe allergic reaction to any component of the COVID-19 vaccine, you also shouldn't get it. The ingredients of each, the Moderna and the Pfizer vaccine, you can find at the CDC website. It's called a fact sheet, and you can look into that yourself. The words are very long and very complicated, so it is a good idea to look that up. Most people who have had an allergic reaction to a component of a vaccine or anything in the COVID-19 vaccine, usually you're gonna know. You will know, and you will know, I should not get this vaccine, but it is still a good idea to look that up. Also, anyone who's had an allergic reaction to polysorbate. Polysorbate is an emulsifier, and it's often used in vaccines as a stabilizer. Polysorbate's also used in many foods and cosmetics. So there's also the level of who should be careful about getting vaccines. Again, anyone who's had a history of a severe allergic reaction to another vaccine, like the flu vaccine or the shingles vaccine, anything like that, that is something you should be very careful about. And also if you've had those same type of allergic reactions to another injectable medication, you should talk to your physician before you think about getting this vaccine. And we also have an allergist in our lovely town of Salida. Her name is Dr. Gupta, and she is available also. And we'll talk a little bit more about that. All right, so how do we handle our vaccine clinics? How do we handle this, making sure nobody has any of these allergic reactions or any kind of reaction? So when they come up here to our fairgrounds, we give the vaccine, and then everyone has to wait 15 minutes post-vaccination. This is just so we can watch them, us, and we also have EMS on site. They're the ones that are right there on the ground, and they're watching and waiting and making sure no one's having any reaction. Anyone with a history of anaphylaxis to any foods, bee stings, pets, any medications, anything in the environment, anyone who's had an anaphylactic reaction, we require them to wait 30 minutes. And so during this time, we tell them before they get over there, we say, I want you to pay attention to your body. If you feel short of breath, if you start to feel any swelling, if you start to see hives or even a rash, anything that's out of the normal, we want you to honk your horn. When that happens, EMS is right there and they are ready to take care of anything that needs to happen. Let's see what else here. Like I was saying before, our allergist, Dr. Gupta, she's been great. Anybody who's had any precautions or contraindications to the COVID-19 vaccine, we can help you get in touch with her, or you can call their office yourself, and they will decide when or if you should get the vaccine. We currently have not had any severe adverse reactions to the vaccine at our clinics. So that is a great idea. We have had the regular run-of-the-mill side effects, which I will talk about next. Well, after this part, I will be talking about it. There's other considerations to not take the vaccine. Anyone who's pregnant and or lactating, there's such limited data on the reaction that could occur with this population that we're recommending they talk to their doctor, and also talk to your doctor to make sure that you're comfortable with it, and so is your doctor. That being said, there have been some pregnant women who have kind of slipped into the clinical trials because they were unknowingly pregnant or they became pregnant in between the doses. And so far, there's been no adverse outcomes with that. Also, anyone who's under quarantine, if you've had a close contact with someone who's tested positive for COVID-19, we want you to wait until your quarantine period is over. This is mainly due because we don't want to be spreading the illness in case you have it. We don't want to spread it to anyone helping you in the vaccine clinic or anyone around you. It's also anyone who's currently infected with COVID-19. You should wait till your full 10-day of isolation is over and you're no longer symptomatic before you get the vaccine. We're also, if you've had COVID-19, you could have been treated with monoclonal antibodies or convalescent plasma. We're recommending that you do not get the vaccine until 90 days after you've been treated with these medications. Immunosuppressed individuals and anyone with an autoimmune disease, it's very important you talk very closely to your physician. If you are able to get the vaccine, that's great. It's just you need to be aware that it is possible that your immune response to the vaccine may be reduced. Side effects, this is kind of what I wanted to talk to earlier, but I was a little early. So what to expect and what do we want to do about it? So Pfizer and Moderna, they're reactogenic vaccines, which that means once you get the vaccine, a physical manifestation of the inflammatory response to the vaccine will occur. Your reaction to it could change. So you should expect on the screen these symptoms. Usually these symptoms will occur 6 to 8 hours after you get the vaccine. The symptoms are, however, self-limiting and very rarely require medical intervention. If you are having any of these symptoms and you feel uncomfortable, you feel, man, this is making me worry, please reach out to your physician. Please reach out to the ER. Don't be afraid to call out and make sure that what you're feeling is normal. The second dose is worse, like it says on the screen. Not for everyone, but it is worse. And the reason for that is because the second dose builds on the first dose. And it causes your body to have more intense symptoms. This is actually considered a good thing. You want this. If you have a response, it means, you know what, my immune system is doing what it's supposed to do. It is building those antibodies. It's building those cells to plan an attack if COVID-19 does enter your world. The more robust you are, so that means the more young and healthy you are, usually you have a bigger response. Those who are 65 and older, it's a normal response in the aging process for your immune system just to become weaker, and it's not as robust and exciting as you are when you're younger. Usually, these side effects last 24 hours to up to 3 days. So again, it is self-limiting. Many people ask, how can I don't want these side effects. Oh my gosh, this is gonna be terrible. I don't want this. How can I stop this or how can I fix this? So the most important thing, you do not want to pre-medicate with ibuprofen or acetaminophen. This may dull your immune response, and we don't want that. We want to have an immune response. So don't pre-medicate, and if you can live through it, let your body do what it wants to do, you should not take any medication to help. If you have to work, or if you have other things, you have children, and you really do have to be at your best, it is okay to take ibuprofen, which is Advil, or acetaminophen, which is Tylenol. We do ask that you wait at least 6 hours after your vaccine before you do that, though.
Okay, we're gonna move on to variants now, which has kind of been a buzzword and something that you probably have heard about. So a variant, as a virus replicates, which is what it does in order to spread and thrive and survive, it's copying itself. And in that copying process, mutations can occur, and that changes its RNA or its written code. So most of these changes are inconsequential. Some can actually be detrimental to the virus, and other mutations will actually give the virus an advantage. So sometimes these mutations will make the virus more easily transmissible compared to other viruses, and it's usually by changing that spike protein structure, which we've talked about. It allows the virus or the proteins of that virus to be able to connect and adhere better to human cells, which therefore makes it more contagious. Mutation can also cause more severe disease, or it can cause a higher death rate. Changes could make it that it's harder for us to be able to be able to test and make sure that it is COVID that we're working with, because it might look a little bit different and the test may not pick up on it. It could cause issues with our treatment, meaning the things that we have that we're currently using to treat severe disease may not be effective anymore. And then the main concern is that these spike proteins would change enough that our vaccines would no longer be effective. Preliminary results from some lab testing at Pfizer do show that it is still effective against all the variants that we've seen so far in those that are fully vaccinated. And we know that even though these vaccines that we are using do connect to or read those spike proteins, they are still working. Enough of that spike protein looks the same that we don't have a concern at this time. There are some scientists that say that this vaccine escape, which is what we're referring to, if it happens, it's not going to happen overnight. It's going to be something that's gradual, and these spike proteins are going to change enough that the vaccine can't read them anymore. But they're thinking that it could be a year of these changes before we could really see an issue. All these variants are still very new. Scientists are really monitoring them. They're using something called strain surveillance. They're watching them really closely, seeing how they're changing, what challenges they might present, and helping us to just continue managing this pandemic as best we can. I want to speak to the landscape, vaccine landscape, specifically here in Chaffee County. This shows you the distribution phases. So we're currently in phase 1B2. So far, we vaccinated our healthcare workers, first responders, those over 65, our educators, and people who work in licensed childcare programs. Next up is 1B3, and that's expected to start on March 5th. This is going to include those with 2 high-risk conditions. There's a whole long list of conditions, to name a few: current cancer treatment, chronic kidney disease, COPD, diabetes, specific heart conditions, obesity, pregnancy. To be able to see the full list of them, you can find it on the state website. 1B3 also includes our frontline essential workers. That definition of frontline essential worker will be shared with us soon from the state. As soon as we have that, we will press it out to the community widely. And then a good reminder too, as we move through the phases, if you were in a phase earlier and you were not able to get the vaccine, or you chose not to get the vaccine and you are now interested, you can get it at any time. Anyone who was previously eligible remains eligible as we work through the phases. We are confident here in Chaffee County that we are reaching everyone who qualifies and wants a vaccine. And we feel confident in saying that because we had open slots this last week. There was a lot of them and they were not filled by people who would qualify. So we are ready to move on to the next phase. As soon as we are given the green light, we will be doing it. We are also very proud because right now Chaffee County is sitting 5th in the state for the number of vaccines administered per 100,000 people. We're doing really well. The 4 counties that are ahead of us have significantly smaller populations than we do. So some would argue that it's easier to vaccinate smaller populations. Chaffee is one of those. We would agree. We have an amazing community and it just works a little bit easier than when you're in a really large city. But even looking at this graph, Chaffee still has the largest population of the top 14 counties. So any way you slice it or dice it, we are doing really well getting vaccines in arms. Specifically for public health, we do vaccine clinics on Mondays and Tuesdays out at the fairgrounds. We do have some occasional days that have different schedules. And those are always posted if it is open to the public. We do, a few weeks ago, we did like a vaccine clinic for the teachers because that was very specific. So far, Chaffee County Public Health has administered 5,237 immunizations. 2,807 of those were Moderna and 2,430 were Pfizer. Throughout the county and to our knowledge, so far 8,647 doses have been administered. And by looking at the data between CCPH and HRRMC, we believe that over 5,000 people have been fully vaccinated so far in Chaffee County. It's hard to get very specific numbers because I will speak in just the next slide. There is other places that are giving vaccines, but this gives us a good idea. This number does also include people who may be outside of Chaffee County. Anyone in the state of Colorado can go anywhere in the state of Colorado to be able to receive a vaccine. We've definitely seen some people coming here from outside of Chaffee County. So this is not just Chaffee County numbers, but it gives us a good idea of what we've done so far. There are others in the county that are providing vaccines. So like I've mentioned, Heart of the Rockies is. If you're interested, watch their website. I just checked, currently no new appointment slots are available. They are finishing 2 large second dose clinics tomorrow. And those numbers that I had said previously, that 5,000 is actually accounting for those people that will be coming tomorrow to finish their second doses. Salida Pharmacy and BB Drug are also offering vaccines. You can call for availability. They also have an email sign-up form on their websites. If you go on there, you can fill in your information. When your phase is eligible, you will get an email notifying you of that. Safeway has vaccine off and on as well. They have a sign-up on their website using their online scheduling tool. As of a few weeks ago, they were also keeping a list of people who would qualify that they could call if they did have extra doses. And then Valleywide and Buena Vista is offering vaccines as well. You can call to check availability there. In the next few months, we are really hopeful that more vaccine will be available everywhere. So pretty much anywhere you're used to getting a flu vaccine, you'd be able to get your COVID vaccine as well, including more pharmacies and your doctor's office too. So these are the places to look now, check websites and keep updated.
All right. We received quite a few questions from some of you to our email address, and I hope we'll answer all of them. And these are directly from you. So, why are scientists so sure that there will be no side effects from the vaccines in 2, 5, or 10 years from now? I first want to say this is a legitimate question and concern, and it's fine to be concerned. But the truth is we just don't know yet because there hasn't been enough time. The first vaccine recipients are not even a year out from their first dose. Some may disagree with me, but this vaccine is incredibly scrutinized, and I just don't believe Anyone is trying to trick us into doing something that they know is unsafe. But we do know some things about vaccine safety long-term. Though the mRNA technology is new, like I said, from the point of the spike protein being made and forward, this vaccine works very similarly to other vaccines. So long-term side effects are rare, but they are possible. There's an article that I've linked in here, and there's a video from Dr. Paul Offit that does talk about long-term side effects. And I really encourage you to read them. To me, it's not scary. It just feels very honest. And I think in this world of vaccine hesitancy, it's really refreshing to see just an honest report of what long-term side effects have been in other vaccines. Okay, so long-term side effects are very rare with vaccinations, but they do exist. One thing to note is they are almost always seen within the first 8 weeks. And before submitting for emergency use authorization, all vaccine manufacturers did have to follow clinical trial participants for the full 8 weeks. Another thing that's really important to understand about side effects that can occur with vaccinations is that those side effects often occur with the disease as well. So for example, in the 70s, there was a flu vaccine that did, in rare cases, cause Guillain-Barré syndrome. However, the flu itself causes Guillain-Barré syndrome 17 times more than the rare side effect from the flu shot. So I do think it's important to recognize that. But we want to be really clear, no vaccine is 100% safe and effective, and we want to be transparent in that. This is a risk-benefit analysis you must make for yourself. But COVID has proven itself to have many, many long-term and short-term risks, both for individuals and for those around them. Okay, next question. Has testing been done on fertility of men or women? What are the results? If not, why not? Okay, so the first round of clinical trials that resulted in this emergency use authorization was a broad general public group of people. They have not studied any specific groups yet. Okay, so specific groups are of interest, and those are being studied right now. So any of these questions about specific groups, the answer is going to be not yet. Now, that being said, many of these groups of interest, including pregnant women, people with autoimmune diseases, immune compromised people, children, they were included in clinical trials, and there were no adverse outcomes of note specific to those groups. Okay, why has no testing of the vaccine been done on those under 16 or pregnant women? Or has it started? And if so, when did it start? Okay, like I said, the first clinical trials were for the general public. We know that adults are the highest risk for severe COVID disease, which is why we studied adults first. But let's start with children. So again, Pfizer is actually approved for ages 16 and older. So when we get to the general public, we can vaccinate 16 and older with Pfizer. But we're interested in children. Children are known to, especially older kids, spread the disease. And so currently, both Pfizer and Moderna are either enrolling or have fully enrolled full clinical trials with children as young as 12. And we do think that by the summer, there's potential for emergency use authorization for those aged kids. Pregnant women is another group of interest because we know that COVID disease can be more severe and risky for pregnant women and their unborn children. So Pfizer has 4,000 pregnant women enrolled currently. And again, we're thinking by the summer, there'll be some sort of answer as to whether we fully move forward with that group. Okay, next question. What are scientists not telling us about these vaccines? Research and development, testing, anything negative? This is a really big question, and I'm not sure the best way to answer it. I hope in this presentation, we've been really transparent and honest about the risks and benefits of vaccinations, but linked at the end of our presentation, the documents that both Pfizer and Moderna had to submit for emergency use authorization, as well as the FDA hearing to discuss the data, are both available to the public. So though it seems to me that everyone's trying to be as transparent as possible. And if you're concerned, I do encourage you to go ahead and read those, or at least listen to the hearing. Again, no vaccine is 100% safe and effective, and there's a small risk in getting vaccinated. But please remember, there's a much larger risk to you and others if you get or spread COVID, and we know this for a fact. I do want to mention a few risks, so because you are going to hear them. There is a higher chance of anaphylaxis with this vaccine than others. It's hard to say whether it's just because it's so scrutinized or whether it truly is a higher risk. So about 11 in 1 million people versus 1 in 1 million people, which is the typical anaphylaxis rate for other vaccinations. As Tanya mentioned, these vaccines are highly reactogenic. So you will likely feel crummy for a day or two. That's really normal, and that's kind of a bummer. This is new technology. We know that. We can't be 100% certain. There are no long-term side effects because we simply have not had enough time. And then lastly, like I had said, there are specific groups that we are really interested in learning about the safety and efficacy for those groups, and we just have not had enough time yet to say anything for certain with them. Oh, okay. One more for me. Research and development on mRNA vaccines has been ongoing for 30 years. Has testing on humans proven no effect or alteration on DNA? If so, how long has human testing been ongoing, and which of these results are based? Okay, we want to be really clear. We did not read through the 30 years worth of research on mRNA vaccines or mRNA technology. However, if we could take a step back and understand how both the Pfizer and Moderna vaccine work, I think it's really probably going to feel like a relief regarding this question of DNA. So these two vaccines use mRNA. mRNA does not go into the nucleus of a cell where your DNA is stored. Okay, the mRNA stays in the cytoplasm of your cell, and it is there that it codes for the spike protein. In humans, the progression is always from DNA to RNA to protein. You can't go from RNA back to DNA in human cells because we don't have the machinery within our cells to do that. The only time that happens is with something called a retrovirus, such as HIV, and there is the potential for DNA generated by retrovirus to integrate back into the nucleus, but that's not what we're talking about here. That mRNA never gets into the nucleus of a cell. I hope that answers this person's question. That's a really brief overview, but I think if you do just a little bit of research on that, it's really a relief that is not seen to be an issue at all.
Unmute. Okay, how long after receiving the second vaccine dose should you wait before working out normally? So science supports activity to boost the immune response. So if you feel good, you're going to listen to your body. If you feel good and you want to work out, please do. It could help. It could also help, especially with the arm that you've had the vaccine in. The more you move it, the better that will feel too. So go ahead and work out. Side effects, like we said before, it could be 1 to 3 days after the vaccine. So again, if you feel bad, just rest your body and just listen to your body. All right, so is it possible to estimate how many people are not willing to get vaccinated in our county? It's perhaps a bit easier to show how many have been vaccinated, and then you can kind of get an idea of maybe these people don't want to, or maybe it just wasn't their time yet. So far in our county, approximately 75% of those 70 years and older were willing and they have received the vaccine. Many of them have received their second dose already. The hospital, 66% of their staff has chose to vaccinate. 70% of other healthcare staff and first responders in the area, they have all been vaccinated. And then school districts, now 80 to 85% of the school staff have chose to vaccinate. This again is an estimation. We do not have an exact science. We're not like check marking every single person that we have in, but this is a pretty close idea of who wants to get vaccinated and who perhaps doesn't. What hurdles do we see that may impact the future vaccination distribution? Well, one hurdle that we'll be able to cross and jump over very, very easily is the more coordination we have with our local partners, the more physicians and the more pharmacies that are able to give the vaccine, that's going to help us. That's going to help get more vaccination in more arms. Allocation, this is pretty much the biggest reason we're not doing 1,000 people clinics every single day is because we're only allocated a certain number of vaccines each time. And so the more vaccine we get and the more allocation we get, the more people we're going to be able to get vaccinated. And we're hoping that, like Cassandra was saying, we're hoping that this is going to be definitely something that's going to happen in the future. The 2 doses with Pfizer and Moderna, it is a 2-dose vaccine. So some of that causes a little bit of a hurdle. We have to make sure that, hey, I've got my first dose, but am I going to be there in 21 days to get the second? And am I going to be there in 28 days to get the second of Moderna? So that kind of can cause a little bit of just a little bit of a problem with planning and communicating, not just on our end with public health and other providers, but on the client's end also. And then these past couple of weeks, we have definitely seen weather. Weather has definitely caused a problem with us getting our shipments and being able to get the trucks on the road with our vaccine. So that can be a hurdle also.
Okay, next question is, how many days after my second shot should my immunity be as high as it will get? So we've said, and according to the research studies that they did on Pfizer and Moderna, about 2 weeks after the second dose is when you're assumed to have full immunity, when your immune system has peaked and reached its highest potential. The first dose does provide us some immunity, but it does seem like it's probably less immunity than the wild virus, which is just if you contracted COVID normally. The second dose is what gives you the immunity that's equivalent or possibly even a little bit better than the wild virus. So again, it's about 2 weeks after that second dose. And then what we've seen also is our long-term protection is not happening until that second dose. So this segues well into the next question, which is, does the vaccine prevent you from spreading the disease or just from getting symptoms? So first off, the vaccine is only 95% effective. So there is a small amount of the population who still may contract COVID. The risk is still there. But those who receive full protection from the vaccine that are within that 95%, some very early data is showing us that even if you're infected with COVID, the vaccine does in fact still reduce the amount of viral particles. So you are just not as contagious. So the transmission is more unlikely. We don't know this all for sure though. There's still research that's being done. We're still following those people. Like Emily said, the first people are not even a year out yet. So we're not positive. So until we know more, even after you've been fully vaccinated, you still need to follow all of the COVID precautions that we've been harping on. Wearing a mask, continuing to social distance, wash your hands, stay home if you're sick. And if you have symptoms, we are still saying test. Even after receiving the vaccine's not going to cause you to test positive. So if you have symptoms, schedule a test and be tested. So what about the potential of COVID becoming an annual vaccine? Again, I think this has been for all of our questions that have come about. We don't know yet. We just don't know enough. We're not far enough out. We need to see how the disease progresses. We need to look at variants and see how they behave. We need to look at the effectiveness of worldwide vaccination. When we know more of that, we will be able to know better how to be able to proceed. Again, we feel like the vaccine is going to remain effective against variants, but that could change. That would mean that we may need a booster dose. There may need to be a completely different vaccine created. Scientists are watching closely to be able to see how we will move forward. As you all know, we do recommend flu vaccines every year. That is because of immunity. It's also because of variants. That could be what we're looking at with COVID in the future as well. It's really just watching and waiting, and only time is going to tell us for sure. And last question that we had submitted is there anything I can do to enhance the effectiveness of my vaccine? As soon as you're able to get your second dose, do it. That's going to be the best thing to make sure that you are going to provide the best immune response. Research shows that spacing to be the most effective, that 21 to 28 days, depending on your vaccine. Get it as soon as you can. But if you're late, just get it as soon as you can. What we've seen is getting a single dose of COVID could potentially be more dangerous than not getting vaccinated at all. And that's because when you get a single dose, your body has seen the spike protein, but it's not developed any long-term protection. So if you got your first shot, you forgo your second, you're actually giving space for some more viral mutations to occur. And we just learned those viral mutations can be more dangerous. So get that second dose. Next, talking about pain medications. If you need them, take them. If you don't need them, don't take them. Definitely don't pre-dose. And if you are going to take them, wait at least 6 hours post-vaccine before taking them, if at all possible. This is going to allow your body to create the best immune response possible. So let it do it. Let it do its job. And then we have some research after flu vaccine that shows that regular moderate intensity exercise like walks, hikes, strength training, dancing, biking, any of those or others gave the people who had received the vaccine and then did these activities a higher immune response. And therefore we can assume a higher level of protection from the disease. So though it's not actually proven yet for COVID, it has been shown true of the flu. Some of our very preliminary data suggests that it would be same for the COVID vaccine. So get your shot, move your body, get some exercise, and there's benefit to all of that.
Okay, and then we just have some resources listed. So both of the Pfizer and then the Moderna emergency use authorization, I guess, large documents, as well as the FDA hearings are included. So definitely check those out if you're interested. They also provide a lot of data on the side effects, which I think can be helpful. And then there are some links to the Center for Disease Control on vaccine information for the COVID-19 vaccines, as well as safety information. And then that last link is on the phasing for vaccine in Colorado. So if you're not sure which phase you fall into or you have any questions, that's a really helpful website. And then there are also 2 podcasts that we like and which can be helpful resources as well.
Does anyone have any other questions? We have a little bit of time left. It's 12:52.
And I would say you can certainly type your question into the chat and we can read it out for the group. Or you should be able to unmute yourself and can verbalize it, and we can just answer it that way as well. So our first question is, if you have leftover vaccines from the clinic, how are they distributed?
I can jump in real quick on this. We really try hard not to have leftover vaccines. And so we ask that everyone has a scheduled appointment. So we have a general idea of how many doses we will need to pull. But as we get towards the end of a clinic, we we pull our doses out slower in case we had people who didn't show up for whatever reason. And so as we go along and we're getting down to the end, we're pulling doses really slow, but there is always the potential, because once you've punctured the vial with a needle, you have to use all those doses, that we will have extra doses. In a Moderna vial, there's a potential for 10 extra doses. In a Pfizer vial, there's a potential for 5 to 6 extra doses. So we always allow a maybe line. This is going to be people who qualify, but for whatever reason don't have an appointment. It can be up to 10 people when we're doing a Moderna clinic, or 6 people when we're doing a Pfizer clinic. Those folks will be first in line to get any extra doses that we have pulled. And then if they don't, for whatever reason, get an extra dose, because they qualified, we really work with them to get scheduled for an actual appointment. There are very rare occasions where we truly are like out of the maybe line has been done. There's 2 extra doses. We need to use them. We've never, ever thrown away a dose at public health. And so those times we really just have to find an arm to put it in. We try our best to find someone who's qualified or perhaps has some high risk conditions, but really it's 4 o'clock. We're about to lose our EMS personnel. Like, we just have to get a dose in an arm. And so occasionally that does happen, but I think over time we have a really tight system to avoid that becoming kind of a dramatic issue, as it very easily could.
Thanks, Emily. The next question is, how will everyone get vaccinated keep the variant? How will everyone getting vaccinated help keep the variant from spreading?
I can, yeah,
Oh,
whichever. I can try to jump on this one. So when we have people who are vaccinated, they are going to, if we look at that spike protein, I guess, backing up, the variant, first of all, at this point, is not extreme enough to evade the vaccine. So the vaccines are still working. Scientists really feel like it's going to have to not just be one mutation, but it's going to have to be a lot of mutations to really change that spike protein enough that the vaccine wouldn't work. So that piece, I think, alone is what we can stand on right now, is that we don't think that it's going to evade the vaccines at this point. In the future, it really depends on what the variant is. And vaccine, the current vaccines that we have, if the variant is extreme enough or has enough mutations in it, the current vaccines potentially couldn't do anything for those. And so that we have the possibility that they wouldn't work. I don't know if anyone wants to add pieces to that.
I just wanted to reiterate your why the 2 doses matter. It's just like why we have to take antibiotics until the end. If you take half of your antibiotics, you leave the big bad bacteria that we're going to survive to thrive. It's the same with viruses. If you don't get both shots, the viruses that survive are the ones that maybe have mutations or are extra hardy. So I think getting everyone quickly their 2 doses is going to be one of our best protections against the variants.
Great. I'm not seeing any other questions in the chat. We've got about another minute or so if anyone has a last question that we want to slide in. While you're doing that, I'm going to open it up to Rebecca so she can announce the employee drawing outcome.
Great, thanks everyone for joining today. Thank you so much to Emily and Clara and Cassandra and Tanya for their excellent presentation and what they're doing 24/7 for us. Thank you, gals. The winners today are Deanna Shoger, Randa Rollo, Kevin, hold on. Kevin Nelson and Pam Dennison. So you 4 will be contacted by Sarah and I afterwards to connect you to your prize. Thank you.
Thanks, Rebecca. I did also want to remind everyone that you can always email questions to the public health team. You know, maybe you wake up tomorrow wishing that you had asked something you didn't have a chance to today. You can reach them at health@chaffeecounty.org and they will get back to you. We will also have this presentation video up on the YouTube channel, as well as the county's COVID page and the COVID-19 Chaffee County Facebook page. So if you want to review anything, go back to the highlights. We will have that up later this afternoon. Thanks everyone for joining us for the Lunch and Learn. Emily, anything else you'd like to close with?
I think my only closing thing would be to watch our communication. We will be moving on to this next group next week on March 5th, we're hoping, and this is a big new tier of people who will be allowed to be vaccinated. There's a lot of details still to be worked out, but we are ready, and our website, when there's spaces for you, we will have it open.
Great. Thanks again, everyone. Have a beautiful, happy, healthy afternoon, and we will catch you all soon. Take care.